We are joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Doctor, welcome back to the show.
Thanks so much for having me, Nima.
So what do we know so far about this new mutation, the E484K variant?
Well, this mutation has been found since possibly around 2020, end of the year, and it has been part of previous strains in Brazil, the B1128 there, and in South Africa as well, the B1351 variants. What we do worry about with mutations like this is what can it do? Can it transmit more aggressively? Can it cause more severe disease, or can it somehow reduce the effectiveness of our immunity? Unfortunately, this third statement may be true, and the E484 mutation can be resistant to vaccines and our natural immunity as well.
And how is this possible, Doctor? How is it able to get past a person's natural immunity and vaccines?
Yeah, well, our natural immunity relies on antibodies. These are cells that can recognize previous illnesses and are usually recognized by their proteins. We use this to fight against viruses and bacteria. Vaccines do the same thing by helping us build these antibodies, but mutations like the E484K are able to actually hide more effectively and bypass those. So the proteins are harder to recognize, and that means the immunity also goes down.
So what could this mean for our fight against the spread of COVID-19?
Unfortunately, it means the fight is not over yet. There's going to be a long way ahead. The fundamentals are still the same, which is the hand washing, masks, social distancing, and vaccinating everyone is going to be even more essential here, and perhaps even looking at better designed vaccines.
Now, researchers in the UK claim that the E484K strain was already part of the genetic signature of the South African and Brazil variants of the virus. So what does that mean exactly?
So it means that the same mutation, which we found in South Africa, may have developed in other strains. So the mutation can occur with any of our strains, including the B117, which is the one from the UK. But what we're seeing is that as multiple strains get this mutation, they would become more resistant to the vaccines.
Now, meanwhile, the South African variant of the virus popped up in Canada without the need for patients to travel. So what does that say about the rate at which this virus is mutating, and why is it continuing to mutate so rapidly?
Yeah, this is definitely concerning because what we know is that coronaviruses now tend to mutate, unfortunately, a bit more often there. And what we're seeing is what we would call convergent evolution or mutation, which means different strains are actually coming up with the same mutations. So something that's concerning, not entirely unsurprising, because we have so many cases in the world and plenty of opportunity for those mutations.
So what does this mean for vaccine development, Dr. Raut? What do we know so far about how well the current vaccines work against any of these new variants of the virus? And do we need a brand new vaccine in the mix here?
So there is some research that the previous vaccines are left a little bit less effective in South Africa in general. Norvax had shown a 89% effectiveness in the UK trials, but only 60% in the South African trials. Johnson & Johnson, very similar. So all of that points to our same mutation here. And likely we may have to look at more effective vaccines or maybe more doses of the vaccines to boost the immune system.
All right, Dr. Raut, what would you say is the best way to prevent more mutations of this virus from popping up in Canada?
So the best way is to decrease caseloads, staying at home, washing hands, mask wearing, social distancing, and vaccinating. The more we vaccinate, the decrease in caseload, and the more effective this will be.
All right, Dr. Raut, about 30 seconds left, but it seems that this battle against COVID-19, it feels as if it's never ending. With new variants popping up and restrictions being extended, how can Canadians stay motivated and safe as this battle continues?
So an excellent and difficult question. Most of us thought that this would be over by now, but we still have a long road ahead. I know many of my colleagues on the front lines are exhausted, but we know we are going to get there. All we have to do is keep pushing and keep the fundamentals in mind.